let's have Frank Messersmith. Where the
Right
mic
here.
is? Right there. Frank Messersmith, if you could ask your question, sir.
My question basically is, if we can, you say here, we can pay for the vast majority of these upfront costs by cutting out fraud, waste, and abuse. If that's the case, why aren't we doing it already? That's a real fair question.
And you know, for years and years, we've been hearing people saying, you know, there's a lot of waste that's going on out there. You now have a president that's going to tackle this issue. And you're going to have a president that also will respond, and I'll answer your question because it's a fair question. That people say, why don't you allow the free market to take care of this also? Well, since the very first bill that was dropped in 1943, every session there's been a bill, but every session that bill has never seen the light of day. We have a president, we have a Congress, we have people that are asking and demanding a change. And when we look at ourselves today, globally and locally, that we're in a world of hurt right now. You lose your job, you lose your insurance. Because your insurance are sometimes connected to your job. And so you will find, people will find themselves in great need. So this is the time we have to do it. And just taking the president's word when he said many presidents have attempted to do this. He wants to be the last.
I want to thank the overwhelming majority of you for listening and speaking when it's your turn and your turn only, so that we can get through this with as many questions as possible. Thank you. Christy, where's Christy? I'm sorry, I can't read the last name. I can't read mine either.
Thank you. I'm Christy Della Geronda, and my question is Medicare considered part of the government program? And I would really love to be able to join Medicare at my age before I reach 65.
Medicare is a government-run program, and it's true. And we'd like to say that the healthcare programs that we're trying to put together through the public option will be much like that. But the concept behind Medicare is that nobody should be going without coverage. My mother was a domestic person, and what I mean by that is she made a living for us, cleaning other people's homes. It was a good job. It was a dignified job, but she had no pension and no health care programs. And my dad had finally got into the post office where he was able to get some health benefits. So at 13, I had my first dental visit. My point is this. Today, my mom's a widow. She had to have an operation, or at least a consideration for an aneurysm below the diaphragm. And it was larger than most people expect. We could not have afforded those visits she had at Stanford and Good Sam were not for Medicare. And because she didn't have that, she was eligible. And with that program, yeah, my mom's here still. So I think that that's not an unusual story. And hopefully this story can be replicated after we go through this healthcare reform.
Lynn Camp, please. Where are you, Lynn Camp? There we go.
My question is this, the way the reform legislation is currently written, I'm not sure I believe that the way it's currently written is necessarily the answer, but my question is, if your constituency contacts your office and basically lets you know that they are against the current legislation that is written, will you vote against it if your constituency is against it?
Thank you for that. You know, people say that the House of Representatives, congressional members are there to represent the people. And I think that that's true. But we have also other functions and other responsibilities. Listening to the constituents is one of them. Deciding what they say, whether it makes, falls within making sense and that is pertinent and it's gonna make a difference is another one. Because when we listen to that, we still have the responsibility of getting as much information as possible and making a decision. So, if you say that, Mike, I came to your office and I oppose what it is that you're doing, I'll thank you and I'll ask you what it is that you want done. And one of the things I'm required to do, as I did as a teacher, is to research the issue, look at its impact, and decide its final impact in our country. And based upon what I understand and the things I want to see happen and the people that will be affected, in comparing our country to other industrialized countries, we need to do this.
It's a shame there's no passion in this room. Paul Arpin, where are you, please? Thank you, sir.
First of all, welcome, Mike. This fantasy of this death panel proposition that's going on right now, would you explain more fully that this is just nothing more than an advanced medical directive? I have had the unfortunate experience of having someone speak for me when I couldn't. And they made the right decision. But they knew my wishes before this happened. If there is a death panel, it's insurance companies.
Going through the bill and everything else like that, I haven't seen anything that speaks to euthanasia or death panels. What I have read was that doctors who take the time to counsel families and individuals at the end of their life will be compensated for that time and not be feeling like they can't spend the time because they will not be compensated. So many of us have experienced end of life experiences with our family members. And I tell you that having a medical person in hospice services is critical in those moments. And so I think that that's a reasonable thing to do. No one said that they're going to decide whether you live or die. That's not in that bill. There's nothing about rationing. In fact, it prohibits rationing.